What if I told you that something as ordinary as the time you take your blood pressure medicine could quietly be putting your heart, your kidneys, and even your life at serious risk? And what if your doctor never once brought it up? If you take your blood pressure medication with your morning coffee, I need you to pay attention. If you take your water pill after 2 p.m., same thing. And if you have ever doubled up on a missed dose without thinking twice, we need to talk. Because what I am about to cover is the kind of information your pharmacist should have explained the day you picked up that prescription. It is one of the most important timing conversations in medicine, and somehow, a lot of people never hear it. I have seen thousands of patients on blood pressure medication, and there is one timing mistake I see over and over again every single week that most doctors never get to in a 15-minute appointment. If you are taking your blood pressure medication in the morning or at night without knowing these specific rules, you may be cutting its effectiveness in half. Or worse, you may be creating a dangerous window where your heart and kidneys are not fully protected. And that is exactly what I want to walk you through right now. Because some of these mistakes sound small, almost harmless, until you understand what they can do. This is the kind of conversation that usually does not happen inside the exam room. It happens after the prescription is already written, after the patient is already home, and after they have already started their routine the wrong way without even knowing it. Stick with me, because timing mistake number 3 is the one that surprises people the most. Before we get into it, if you have not subscribed yet, go ahead and hit that button and turn on the bell so you never miss another health tip made for real people trying to protect their health. And if you find this helpful, drop a 1 in the comments. If not, drop a 0 and let me know how I can make the content better for you. I'm Dr. Thomas. I started this channel because the kind of information that protects people's lives in my clinic should not stay locked inside my clinic. After 26 years in medicine, I have watched blood pressure medication become one of the most commonly prescribed drug classes in the United States. And I can tell you this: most patients are told what to take, but not when to take it, what to take it with, or what to avoid. That missing information is costing people their health. Today, I am going to walk you through the 5 most dangerous timing mistakes people make with blood pressure medication. These are the kinds of mistakes that can reduce how well the medicine works, raise cardiovascular risk, and in some cases trigger real emergencies. And I will tell you exactly what questions to ask your doctor or pharmacist before your next dose. If this is the kind of honest, practical medical information you want in your feed, subscribe now. It takes 1 second, and every week I put out a long-form video just like this. Let's start with mistake number 1. Choosing morning or bedtime dosing for ACE inhibitors and ARBs without understanding the difference. This is where a lot of older adults get confused, because these are some of the most common blood pressure medications out there. We are talking about ACE inhibitors and ARBs, drugs like lisinopril, ramipril, losartan, and valsartan. Millions of people take these medications every day. For years, the default instruction was simple: take it once a day in the morning. But that was more habit than science. Research has shown that people who took their blood pressure medication at bedtime had significantly better cardiovascular outcomes than people who took it in the morning. That means a lower rate of heart attacks, a lower rate of strokes, and a lower rate of death from cardiovascular causes. The reason has to do with the way blood pressure naturally behaves. Blood pressure does not stay flat all day. It follows a rhythm. It usually dips during sleep, then climbs sharply in the early morning hours. That sharp rise is known as the morning surge. And that morning surge is exactly when heart attacks and strokes are more likely to happen. So the logic is pretty straightforward. If you take a medication at bedtime, it is still working during that vulnerable early morning window. If you take it in the morning, it may already be peaking and starting to wear off by the time that danger period arrives. That is not a tiny difference. For some patients, The difference in cardiovascular protection can be meaningful. But I want to be careful here because the science is still evolving. Some studies show a clear benefit to bedtime dosing. Other studies do not show a major difference. The right answer depends on the specific medication, your blood pressure pattern, and your overall health situation. So what I tell patients is this: ask your prescribing physician, should I be taking this at bedtime instead of in the morning? That one question can make a big difference. And if your doctor can give you a personalized answer based on your history and your numbers, great. If they have never even considered the timing question, that tells you something too. Now let's move to mistake number 2, and this one catches people off guard all the time. Grapefruit and calcium channel blockers. I've had patients do this every morning without the slightest clue it was a problem. Grapefruit and grapefruit juice contain compounds called furanocoumarins. Those compounds block an enzyme in your digestive system called CYP3A4. That enzyme helps break down many medications, including certain blood pressure drugs in the calcium channel blocker family, like felodipine, nifedipine, and amlodipine. When that enzyme gets blocked, the medication does not get processed the way it should. Blood levels of the drug can rise dramatically, sometimes to unsafe levels, and that can lead to an exaggerated drop in blood pressure, dizziness, fainting, and in some cases, dangerous arrhythmias. Here is the part that makes this especially tricky. The effect of grapefruit can last up to 24 to 72 hours after you eat or drink it. So this is not just about the exact moment you consume it. A glass of grapefruit juice at night can still affect your medication the following morning. If you take any calcium channel blocker for blood pressure, you need to ask your pharmacist a very direct question. Is grapefruit a concern with this specific drug? Do not assume the answer is no. Ask. That simple question could prevent a serious complication. This is not one of those warnings that always jumps out in bold letters on the prescription label. And yet for the people taking affected medications, it is a real risk. I have seen patients who were having half a grapefruit every morning because they thought they were doing something healthy. They were trying to be careful, trying to make good choices, and they had no idea they were interfering with how their blood pressure medicine worked. Not because they were careless, but because nobody told them. That is the problem. It is not always the patient doing something wrong. Sometimes it is just missing information. Now let's talk about timing mistake number 3, because this is the one that surprises people the most. This one is not about food, and it is not about a drug interaction. It is about something much simpler, and the consequences can be serious. I am talking about taking your diuretic too late in the day. Diuretics, sometimes called water pills, are a major part of blood pressure treatment. Medications like hydrochlorothiazide, furosemide, and chlorthalidone help your kidneys remove extra fluid from your body. That lowers blood volume and reduces pressure. They work well, but timing matters a lot. The problem I see is that many patients take their diuretic in the late afternoon or evening. Sometimes they forgot the morning dose. Sometimes they were never told what time to take it. And sometimes they just figured any time of day would do. But when a diuretic is taken too late, the predictable result is frequent urination at night. A lot of people shrug that off and think, that is just what the medication does. It is not. It is often a preventable side effect of poor timing. And this matters for far more than sleep. Think about what happens when an older adult keeps getting up in the middle of the night in the dark. They may be groggy. They may be slightly disoriented. Their blood pressure may drop when they stand. Their balance may not be great to begin with. Now add a bathroom trip in the middle of the night, maybe in a hallway with low lighting, maybe alone, and the risk of a fall rises significantly. That is not a small inconvenience. Nighttime falls in older adults are a major cause of hip fractures, and hip fractures in patients over 70 carry a 1-year mortality rate of 20 to 30%. Let that sink in. That is the real consequence of taking your diuretic at 6 p.m. instead of 8 a.m. It is not just a nuisance. It can be the beginning of a chain of events that leads to a serious injury and a completely different health outcome. The rule I give patients is simple. If you are on a diuretic, take it in the morning, ideally before 10 a.m., so the peak effect happens during the day instead of during the night. If you are on a twice-daily diuretic, the second dose should usually be taken no later than 2 p.m. After that, you are setting yourself up for nighttime disruption that can create real physical danger, especially for seniors living alone or anyone with limited mobility. Sometimes one small adjustment in timing can prevent a fall that changes everything. If you are still with me and finding this useful, type 1 below so I know you are here. Now let's move on to point number 4. Mistake number 4, taking beta blockers with your morning coffee. This is one of those habits that feels normal because so many people do it without thinking. People taking beta blockers, medications like metoprolol, atenolol, carvedilol, and propranolol, often take them in the morning. And a lot of those same people pour a cup of coffee right after. Here is what is happening in the body when you do that. Caffeine is a stimulant. It activates your sympathetic nervous system. That means it can raise your heart rate and temporarily bump up your blood pressure. Beta blockers work by blocking that exact sympathetic activation. They slow the heart rate and reduce the force of the heart's contractions. So if you take a beta blocker and a strong dose of caffeine at nearly the same time, you are basically pressing the gas and the brake at once. For most people, the medication wins and nothing dramatic happens. But in patients with certain cardiac arrhythmias, that combination can trigger palpitations or irregular heartbeats during the period when caffeine is peaking, which is usually about 30 to 60 minutes after ingestion. There is also evidence that caffeine can interfere with how certain beta blockers are metabolized, especially metoprolol, in people who have specific genetic variants that affect drug processing enzymes. That is a more specific issue, and for most people it is not a dramatic risk. But for someone with a history of arrhythmia, it is definitely worth discussing with a cardiologist or the doctor who prescribed the medication. My practical recommendation is this. If you are on a beta blocker for blood pressure or a heart condition, wait at least 30 to 45 minutes between taking your medication and drinking coffee. That is a small adjustment. It does not mean giving up coffee. It does not mean changing your whole morning routine. It just creates a little window so the medication and the caffeine are not hitting your system at the exact same moment. For many people, that is a low-stakes change. For people with rhythm issues, it may be clinically meaningful. And if you are drinking multiple cups in the morning, which a lot of seniors do, that is definitely a topic worth bringing up with your doctor. Now let's get into mistake number 5, and this is the one I see most often, and the one that can be the most dangerous depending on the medication. Doubling up or skipping doses without a plan. This one happens all the time. A patient misses their morning blood pressure pill. Then they remember at noon, or at 3 p.m., or even at dinner. Their first instinct is usually, I will just take 2 tonight to make up for it. That sounds reasonable to a lot of people. But depending on the medication, that can be a bad idea. For some medications, it is not a major issue. For others, especially certain calcium channel blockers, certain ARBs and beta blockers, taking a double dose can cause a sudden drop in blood pressure. That can mean dizziness, fainting, and for older adults with less stable circulation, a fall. So now you are back to the same fall risk we talked about with diuretics, except this time the trigger is not nighttime urination. It is a well-intentioned attempt to catch up. There is another version of this mistake that I see even more often. Some people are prescribed twice-daily medications, but they decide to take them once a day because it is easier to remember. They do not always tell the doctor. Then the blood pressure looks kind of okay at the appointment because they happen to be in a good window when the reading is taken. The doctor sees a number that seems acceptable, and the medication dose is never adjusted. But the truth is that the patient is not getting full 24-hour coverage. That is a problem. If your medication is meant to protect you all day and all night, but you only take it once, there may be several hours when your blood pressure is not controlled at all. And neither you nor your doctor knows it because the blood pressure check at the visit happened to fall during the time when you were still covered. The standard guidance is this: if you miss a dose and it is still the same day, take it as soon as you remember, unless it is close to the time of your next dose. If it is close, skip the missed dose and go back to your normal schedule. Do not double up unless your doctor or pharmacist specifically tells you that it is safe for that exact medication. Because the answer depends on the drug. What is fine for one medication can be dangerous for another. Now I need to pause and say something very clearly. Everything I have shared so far, every timing rule, every interaction, every pattern I have described, is for educational purposes only. This is not personal medical advice. It is not a substitute for talking with your own doctor, your cardiologist, or your pharmacist. And it is absolutely not a reason to stop taking your medication, skip a dose, or change your routine on your own. I want to say that again because it matters. Do not stop taking blood pressure medication without speaking to your doctor first. Even if something in this video surprised you, even if you feel fine, even if your numbers look good, stopping blood pressure medication suddenly or lowering your dose without supervision can cause a dangerous spike in blood pressure. That can put you at immediate risk for a heart attack or stroke. That is not something to gamble with. Blood pressure is called the silent killer for a reason. A lot of people with high blood pressure feel absolutely nothing. That means you cannot rely on how you feel to tell you whether your pressure is actually under control. You can only measure it, and you can only manage it safely with consistent, medically supervised treatment. Feeling fine does not always mean your blood pressure is fine. This channel exists because I believe patients deserve honest, complete information. Too often, people leave a 15-minute appointment with a prescription in hand and almost no real guidance about how to use it safely. That gap is what I am trying to close. Not to replace your doctor, but to help you walk into your next appointment better prepared and with better questions. The information I share here is based on peer-reviewed clinical research, established medical guidelines, and 26 years of practice. But medicine is not one size fits all. Every person is different. Every medical history is different. What is true for most patients may not be true for you. That is why your physician's guidance, based on your full history, your lab work, your other medications, and your own risk factors, always comes first. And if you are having chest pain, sudden dizziness, a severe headache, vision changes, shortness of breath, or anything that feels seriously wrong, stop watching and call 911 or your local emergency services right away. Those are not symptoms to sit on or look up later. Those are symptoms that need immediate medical attention. If this video raised a question for you, write it down and bring it to your next appointment. If you are unsure about your medication timing, if you do not know whether grapefruit affects your specific drug, if you have been missing doses and do not have a plan, those are exactly the things to ask about. That is what this video is for. Ask the questions. Have the conversation. Let your doctor give you a personal answer. This content is not sponsored. I have no financial relationship with any pharmaceutical company. My only goal is to give you the kind of clear, honest, clinical information that helps you take better care of yourself and ask smarter questions of the people responsible for your care. Take your medication. Follow your doctor's instructions. Use what you learn here to have a better conversation, not to make decisions on your own. Before we wrap up, I want to leave you with this. Blood pressure medication saves lives. The evidence for treating hypertension is some of the strongest evidence in all of cardiovascular medicine. I am not telling you to stop your medication. I am not telling you your doctor made a mistake. What I am telling you is that the conversation about timing, about when you take it, what you take it with, and what to do if you miss a dose, is a conversation that often does not happen in a short appointment. And that gap can have real consequences for real people. I have seen it over 26 years in practice. The medication is correct, the dose is appropriate, but the timing is off, and the outcome suffers. If you are over 60 and taking blood pressure medication, or if someone you love is, here are the 5 questions to bring to your next appointment. Should I be taking my medication in the morning or at bedtime? Are there any foods, supplements, or drinks I need to avoid around my dose? What should I do if I miss a dose? Is there a specific time of day when my blood pressure tends to be highest? And are there any timing interactions with my other medications? Those 5 questions, asked clearly, will do more for your cardiovascular protection than anything I can tell you in a YouTube video, because your physician has your full history and I do not. But I can make sure you know the questions are worth asking in the first place. If this gave you something useful, something you did not hear at your last appointment, share it with someone you care about who is managing blood pressure. And subscribe, because every week I am going to keep bringing you the kind of clinical information every patient deserves. If you enjoyed this video, leave a comment with 1. If not, leave a 0. Your feedback matters. And do not forget to like, share, and subscribe for more videos like this. Thank you for watching, and here is to living life on your own terms.